Good afternoon, everybody. I'm Jody Hanson. I'm Director of Public Affairs and Communication for Johnson County. Thanks for being with us this Friday afternoon. With us this afternoon is Dr. Sami Ariola, who is here to give us an update. We also have Brett providing our ASL services. So thank you for providing your interpretation services. We really appreciate it. Dr. Ariola, what would you like to start with today?
Thank you, Jody, and good afternoon, everyone. I do want to start off by saying that our clinics throughout the week, including the one today, went pretty well. We had slightly over 1,100 persons show up for their appointments today. Our appointment today, as well as the one on Tuesday next week, is still focused on our residents that are 80 or older. However, beginning Wednesday, our clinic will be focused on those that are 65 or older. And it's not just our clinic, our partners, health systems continue to vaccinate in that group, as our pharmacies. A few of the pharmacies, even though the doses are not nearly enough, but all of our health systems, as well as a few pharmacies and us, are continuing to vaccinate in that group. I was checking our numbers just before this Facebook Live event, and we continue to vaccinate and put vaccines into the arms of as many of our residents as we can. The numbers that I had was really we've collectively in the county have vaccinated first and second doses over 72,000 of our residents. And I also know that the data is still missing some from some of our partners that are yet to be able to upload their data. So it is slow, but it is progressing. And I've had a lot of people reach out to me today and earlier in the week saying that I'm 65 plus. I've completed the online vaccine interest survey. When will it be my turn? Well, while I can't answer definitively when your turn will be, here's what I know. We are continuing to vaccinate and vaccinate 7,000 out of this group, out of this really large group every week. And so shaving off 7,000 persons from the pool that we're picking from increases your chance every single week. And just before I came on here, I had word that KDHE, Kansas Department of Health and Environment, is going to be providing us additional 3 trays next week, and that translates to about 3,500 doses. And so those are additional persons that will have the opportunity of getting vaccinated next week. And so pretty excited about the trend, still not as much as we would like to have. I was chatting with one of our hospital chief medical officer earlier, and it was like, okay, we have this capacity. We have this many appointments that we can make. We just don't have enough vaccines. And I said, well, that's the same thing with us. We have appointments next week that until these additional trays came in, we actually did not have enough vaccine to cover. So we're pretty happy that we have that. Pretty happy that we are going to be able to provide additional vaccines to our partners. Again, that just translates to you, our residents, getting more vaccine next week. And so that's very exciting. As a reminder, again, Tuesday is focused on 80 plus first dose. Wednesday, 65 plus first dose. Thursday is Pfizer second dose. Part of Friday is Moderna second dose. And part of Friday is also Pfizer second dose. And I do want to spend some time on the second dose of Moderna because there was an article today and people, I wanted to make sure that the message there is clarified. Now, we did open up appointments Friday next week, February 5th, I think, for appointments for all of our remaining persons on our list for Moderna. And I was just checking the number again prior to this event. And we know that there are some of you that have not taken that up. That could be because scheduling is not conducive for you. So I do want you to know a few things. Number one, we have your dose. We have your vaccine. Number two, even though we want you to be able to come on Friday, if you can't, for scheduling or for any other reasons, you will continue to have the opportunity to get your second dose. So I don't want anyone to interpret that as after Friday, you cannot get your second dose. That's inaccurate. We are also facing the same thing with the Pfizer second dose. We've got a lot of appointments still remaining on Thursday and Friday for those that are due their second dose. We want you to take up those appointments. However, if you don't, because of scheduling or other issues, your vaccine is here and you continue to have opportunities to get your second dose. I do want to make that as clear as possible. So not being able to make it on Friday does not mean that you won't be able to receive your second dose. Those are the things that are happening. So our clinics next week will still continue to be at Okun. And I forgot to mention that in addition to those 4 clinics, we have 2 other clinics that are ongoing next week on Wednesday and Friday at our Sunset building here. And that is focused on the second dose for law enforcement, as well as vaccination for continuity of government. So really, we have 6 clinics that are ongoing next week.
Okay, good. That was some great information. So going back to people who are still waiting for their second dose, whether it's Moderna or Pfizer. So according to our records, we feel like we have reached out to everybody in that pool. So if there's somebody out there that's listening that maybe hasn't heard or didn't get an email, I know maybe we would suggest that they check their spam or their junk email. But if they simply can't find it or didn't get it, what's our advice for them?
If you're due your Pfizer or Moderna doses, for the Moderna, which is your specific question, Jody, we had sent the information about booking second appointments to everyone that's on our list. Now, if you did not receive that, again, email us jcdhe@jocogov.org or call us 913-715-2819, and we have people there that would assist you in booking your appointment. We have your vaccine, we have the appointment, and again, if it is if it's not convenient for you that Friday, even though we have the appointments and you are there, we still want to assure you that you will have the opportunity to get your vaccine. All you really need to do is to contact us. Just like I've said with the 80 plus, we have reached out to every 80 person that's 80 or older on our list. And that's why we set up the appointment yesterday, today, and Tuesday. But some may not be able to make it, and that's okay. And just because we are saying that we don't have a clinic that's strictly focused on that group does not mean that we don't keep working everyone in. So everyone that qualifies, whether it's in phase 1 or any of the priority groups that we have done likely finished, we will continue to work you in. So you do qualify for the vaccine. We have your second dose. If you can't make it on Friday, you let us know. We'll do our best to work you in as quickly as we can. But we do have still quite a few appointments remaining for Moderna on Friday.
Okay, good information. So law enforcement, second dose on Wednesday and Friday. Do those individuals need to make an appointment, or what should they do if someone in law enforcement is listening and knows that they are due for their second dose? What do they need to know?
Yeah, they do not need to make an appointment. We have reached out to them. The hours are between 8 a.m. and noon, 12 noon, and they can show up on either day, Wednesday or Friday. And also yesterday, as a reminder, we actually started not requiring people to make a second appointment. Right after you are done with your first shot, you receive information about what your second, when and where your second dose will be due. And that's typically the same place, the same time. That's working very well. I got a couple of emails with actually with a couple of pictures, people showing me how they got their appointment, how things went pretty well. And so that's one less thing to worry about, booking a second appointment right now after your first dose, or beginning next week. From the time that you book your first appointment, you will be able to know where your second dose will be received. So those are pretty good developments.
I think that's a nice improvement that is going to make life easier for our residents. One less thing they have to do. We'll go ahead and take some questions now. We've got someone that works in a grocery store. Can you give me an idea when grocery store worker will be able to get the vaccine?
Yeah, excellent question. I will not be able to tell you specifically when, but I can tell you that that's going to be occurring after we have moved through the 65 plus. And I say that because we have enough doses to finish educators K through 12, and about enough doses to finish childcare establishment. So really after 65 plus, which depending on how many doses we're getting, and depending on the percentage of people, of our residents who are taking the vaccine, we could really be close to vaccinating a huge percentage of this group in about 4 weeks, depending on how many vaccines that we're getting. If we are not getting any more than we're currently getting, that could be 5, that could be 6 weeks. And so my best guess is sometimes towards the middle to the end of April, depending on availability of vaccine, we could be moving to grocery store workers and other tiers in phase 2.
And so if you are in phase 2, but maybe you are a grocery store worker or a food worker or something like that, should they be taking that interest survey, that's the same interest survey that's been available for others for phase 2?
Oh, absolutely. You should go to our website and complete the online vaccine interest survey. And I do want to really add to the fact that grocery store workers, transit workers, DMV workers, all of those are people that are critical, essential workers who are at the forefront, who are there even when we had lockdowns and people were home. So my point to you is you're very important in this effort. You are high up on our priority list. And I don't want to give the impression that because we are focused on a more vulnerable group, our older population, that you are any less important. You are very important. The only reason why is we just don't have enough vaccine, and we are having to prioritize our most vulnerable population. But you're right up there. So go ahead and complete that online vaccine interest survey, and as soon as we move through much deeper into finishing this group, you would move right up and be on top of our priority list as soon as we possibly can.
We have a question about a healthcare provider. So a healthcare provider would have been able to get a vaccination during phase 1, but maybe wasn't able to for whatever reason. So there's a healthcare worker that is that link that's available for healthcare workers. They just can never find an appointment available there. So what should someone who's a healthcare worker that should have been vaccinated during phase 1, what should they do?
Yeah, a couple of things. We have been doing our best to work healthcare workers in as much as we can. Obviously, it still comes down to the same thing. Every time we open up appointments, they are quickly taken up because there's just a lot of demand and not enough supply. But here's what's in the works. We are about to open up an online survey targeted towards the remainder of the healthcare workers, either those that were missed or those that are changing their minds. That way we'll have an idea of how many persons we are dealing with in this category. And once that's open, we'll ask you to go and complete that. That would allow us to plan specifically for how to work you in. But I will say that you continue to look at our website. When appointments open, you do qualify because you're in phase one. If you book an appointment, we'll make sure that you are vaccinated. But we are taking an extra effort to catch all those that are missed or those that are changing their mind, so we can know how many persons we're dealing with, and make plans to work all of you in. We want to get you vaccinated.
We have a question. Can we schedule appointments at pharmacies in other Kansas counties? So they live in Johnson County. Can they go to another county to get a vaccination?
So the instructions for the pharmacies are not coming from us. Those vaccines are being sent directly to them by the federal government. And the instruction that they have is to focus on the 65 plus now, and to adhere to the rules at the state. Now, whether the rule in Kansas mean that you can get from other counties, I think my guess is yes, just based on conversation with the state, is they want everyone vaccinated just like we want. Now, there could be rules within the different pharmacies in the different jurisdictions that, just like we are restricting our vaccinations to our residents and those that work here. Those are things that I don't have a full knowledge of, but I suspect that if you talk to the state, they just want as many of our residents vaccinated as possible.
And we have another question about second dose Pfizer. So someone that's due for their second dose Pfizer on Wednesday, should that person have already been notified? Or someone that's due for second dose of Pfizer on Wednesday, when would they be notified?
They should have been notified. We have appointments still open on next week Thursday and next week Friday for Pfizer second dose. Again, check your spam folder. If you did not receive that, then reach out to us, call us 913-715-2819, or email us jcdhe@jocogov.org. Again, we have appointments open. Reach out. One thing for people to keep in mind is every week we are basically vaccinating about 6,000 persons. We are reaching out to perhaps double that number of people, fielding about 1,000 calls every day. So and sending out emails and notifications, several thousands every week. So again, if you don't receive the message, or it's in your spam folder, or you miss it for whatever reason, second dose clinics are planned for next Thursday and Friday for Pfizer, and we still have, last time I checked a couple of hours ago, we still have openings available. So reach out to us if you don't see the message, and one of our staff will assist you in booking a spot.
It sounds good. I feel like we're caught up pretty much on questions. Is there anything else you want to recap, or anything that you didn't get to cover that you'd like to mention?
Just thank you, Jody. Just that, and our residents, just that last week, earlier this week, sir, we got the good news of additional doses for our educators. Today, we got the good news about additional doses for the rest of our residents in phase 2. So those are really good, even though they don't seem like a lot. That's kind of what we are expecting. So for this week, for the upcoming week, rather than the normal 8,100 doses, we are getting 11,000 plus doses. So that changes our timeline, that changes our calculation if that becomes a frequent occurrence. So we're pretty excited about that. Just means, again, that more of you will be vaccinated next week than we're able to do this week. And continue to exercise patience. If you have signified interest by completing our online survey, we'll reach out to you. And if you are vaccinated by one of our partners, that's okay too. Our partners are ready to ramp up. They need more doses. We need more doses. And so as the doses are coming in, we are dispensing them. Our problem is not being able to get rid of, to vaccinate quickly. Our problem is we don't have enough. So as we get more, the capacity is there, we are vaccinating more, and it just increases your chances of getting called. So we continue to ask you to exercise patience. We are all working towards the same goal. You want the vaccine, we want to give it to you. Thank you.
Thank you so much, Dr. Ariola. Great information today, and we'll look forward to more information next week. So thank you, Brett, for being our ASL interpreter. We really appreciate that. Thanks to everybody on Facebook that was watching today and asking questions. And I hope you all have a great weekend. Thank you very much.